Hello, everyone. It's lovely to be with you virtually today and to have the opportunity to present this paper looking at financial costs for families and people living with cerebral palsy in Australia. So for those of you who don't know me, my name is Georgie, and I work at the Cerebral Palsy Alliance, and I'm presenting these findings today on behalf of our team of investigators. So in 2018, cost estimates for CP in Australia were completed, but we noticed that they did not include out-of-pocket costs for families. So this study, which we are currently in the process of publishing, estimated the out-of-pocket costs for Australians living with CP and their families by age group, as well as gross motor severity. And the second aim was looking at levels of financial distress which families might be experiencing. So, and you just have to excuse my cough. We answered these study aims through a cross-sectional survey, and we developed a survey specific to disability-related costs that people with cerebral palsy might have. And this was done based upon a literature review, but importantly, in consultation with 3 research partners who have lived experience of CP. And you can see here that we ended up with 9 different categories, which we asked people about. And we also have lots of open-ended questions. So once we piloted the survey, we recruited families through the CP registers across Australia. So today this evening, we'll look at some total median out-of-pocket expenses for everyone. And then we'll look at what type of cost estimates change significantly depending upon GMFCS level and age. We use general linear models to determine predictors of these out-of-pocket costs, accounting for income, private insurance, and disability funding. I'll also show you the proportion of people who reported experiencing financial distress, and we'll have a look at some of the qualitative data which really helps to contextualize some of these cost estimates when we're trying to interpret them. So we had 271 participants with a clinical characteristics representative of the Australian CP population. The main overall big picture finding is that 94% of participants had out-of-pocket costs because of cerebral palsy. And just as a bit of context, 85% of our sample were already receiving some form of disability funding. And the overall median out-of-pocket expense for everyone was about $4.5 per year. But we had a really large range, with some families spending up to $20,000 or over $20,000 per year. Now, if we break it down into GMFCS level groups, people with CP classified as GMFCS 1 to 2 had an annual median cost of about just over $2,500 per year. For people with more severe cerebral palsy, overall their out-of-pocket expenses were twice as high, and the median for this group was nearly $11,000 per year. People with more severe CP had significantly greater costs for technology and transport relative to those with milder CP. And 52% of this group, so those with CP classified as GMFCS 3 to 5, 52% said they would like to be able to spend more on assistive technology. In terms of age, types of out-of-pocket costs varied across age groups. So the greatest out-of-pocket costs for young children was personal care for adolescents and young people. It was health, and for adults, transport. And in terms of types of costs which change over time with age, costs spent on home modifications change significantly over time. And so the group with the greatest out-of-pocket expenses for home modification costs were young people with in the GMFCS 3 to 5 group, followed by adults in this group. And of this group, 70% of people with more severe cerebral palsy wanted to spend more money on home modifications. So before I start talking about financial distress, I just want to bring up 2 points which came out of the qualitative data. So the first notion was this idea of additional costs. So we tried to ask people about those 9 categories, but we still had lots of people, and this is only a short sample list, but lots of different costs which crop up either directly or indirectly because a family member might have CP. So an example would be childcare costs for siblings during hospital appointments or stays, increased rent for larger housing to accommodate, assistive technology equipment. So the reason why this is significant is because it means that our cost estimates are likely are an underestimation. Because there were lots of other additional costs which we didn't factor into or ask people about. The second idea which came out of the qualitative data was this idea of being unable to afford these out-of-pocket expenses. So this is really important when interpreting the cost estimates, because we found that people were saying that they might not have these out-of-pocket expenses, but that's because they can't afford them. It doesn't mean that their needs are being met and actually they're going without because they don't have the money. So one quote from a participant here, you can see was explaining they are unable. The only reason we haven't had to pay for vehicle and home modifications is because they're unable to. So I'm just going to pause for a second. So if we have a quick look at financial distress, we saw that over a third of people are reporting high levels of financial distress, and this data was collected around 2020. So obviously it's sensitive to the economic climate as well. We saw that people with higher incomes experience less financial distress. However, after controlling for indicators such as income, NDIS funding, age, and GMFCS level did not significantly predict financial distress. And then just quickly, I'll come back to the qualitative data because this really helps to kind of highlight some of the reasons as to why people are feeling this financial distress. So a lot of people were talking about whether they were adults with CP or carers, having a reduced income, so either an inability to work or reducing their hours. You can see here a quote from one of the participants saying how hard that is with the frequency of early intervention therapies. The second idea that people were talking about was uncertainty. So a lot of unexpected costs that can crop up, as well as uncertainty in securing disability funding and the worry around that. The third theme or idea, which people were talking about in relation to framing financial distress, was interacting with funding schemes, and in particular the NDIS. So overall, people were extremely grateful for the support of the NDIS, and were very pro NDIS. But there was definitely an acknowledgement there that these out-of-pocket costs still exist. And that navigating the NDIS is not always straightforward. And finally, people were talking about, the importance of support networks and how this can really assist with reducing financial concern. So in terms of some take-home messages, the clinicians, I guess just considering that when planning and treatments and interventions with families and people with CP, that there might be a lot of competing out-of-pocket costs for them to consider. And then for families, we really hope that we can use this work to, for advocacy purposes and to help get appropriate funding, and put some more measures in place. So we're in the process of consulting with some of the participants and some of the advocacy team members at CPA, that if anyone has any ideas, we are all ears. So just thank you to everyone who participated. Our research partners, I can see some of you on the call, and our team. So thank you so much. Lovely to share that with you.